All right, folks, we are just about to get started. We're going to give it just about 1 minute for everyone to get in here, and we're just on for a very quick lunchtime hour. So we won't let it drag on. We will get started just in about a little bit less than a minute here. For those of you who are on, let me just check my mic real quick. For those of you who are live right now, can you just put in the chat that you could see and hear me? Can you put in the chat that you could see and hear me just so I know? Okay, great. Excellent. Excellent. Perfect. Perfect. Now let me just share my screen to make sure everyone can see my screen. Can you also just let me know that you can see the slide? Okay, great. Awesome. And while you're in the chat, we'll just go ahead and get started, folks. Welcome. My name is Dr. Sam Himmelstein, and I'm the CEO of Family Spring, and I'll tell you a little bit more about that. While you're in the chat, if you could just put where you're calling in from and what you do. If you're a provider, maybe you're a therapist who works with youth, or a teacher, or maybe you found out about this because you're a parent or a caregiver who either has a teen who is struggling or works with teens or knows somebody. Just let us know who you are and where you're calling in from. Great, awesome. We have folks from all over Chicago, Fort Lauderdale, California. It's going so fast, it's hard to read. Okay, so we are going to go ahead and get started. Let me just make sure my clicker is working. Okay, here is my shameless self-promotion, folks. Like I said, my name is Dr. Sam Himmelstein, and I love to connect with people over this work. My wonderful assistant, Fergie, is going to put some links in the chat, and she'll do it again when it starts to calm down a little bit in the chat. That's our Facebook and our LinkedIn link for Family Spring, and also my own personal LinkedIn profile as well. Please feel free to stay in touch. Feel free to connect. I love connecting with like-minded folks around this work. And then the other one too is the YouTube channel for Family Spring. The reason why that's super important is the replay from today is going to go on our YouTube channel. And we put a lot of evidence-based tips on there. I put a lot of mindful meditations on there, things like that, that you can actually use for your kids. If you have teens who are struggling, or if you're a provider, you could send it to parents or use it with the young people that you work with. So make sure to go ahead and like and subscribe to our YouTube channel, because over time, we're going to be putting a lot more up there. Okay, so let me tell you a little bit about myself. I wish we could all be in the room together, but we're still doing the virtual thing. Like I said, my name is Dr. Sam Himmelstein, and I'm a licensed psychologist by trade. Most of the work that I've done has been working with trauma-impacted, substance-using youth who also struggle with other types of co-occurring disorders, depression, anxiety. I've worked with kids in juvenile halls and outpatient chemical dependency settings and inpatient settings. I've worked in schools, private practice settings. Family Spring, my company that I'll tell you about a little bit later, we contract with the local juvenile halls. We see kids in private practice, online, in person, everything, right? So that's kind of who I am by trade. And over the years, I really found that it was extremely necessary for me to gain expertise. If I was going to work with substance using youth, I needed to gain expertise in trauma. I needed to gain expertise in the things that would actually help them. So I've written a few books. My first book was called A Mindfulness-Based Approach to Working with High-Risk Adolescents. I published that in 2013. One that may be very pertinent to today is I published a curriculum called Mindfulness-Based Substance Abuse Treatment for Adolescents. And this is kind of a 12-session mindfulness-based, evidence-based substance use disorder treatment curriculum. And this is what we build around in our program here at Family Spring. And then my most recent book is called Trauma-Informed Mindfulness with Teens. And as you can see, mindfulness is in all of the titles. One of the things we're going to go over today is some of the skills that we teach teens who are struggling with substance use, who are struggling with other mental health issues. And I'll talk a little bit about and give some pragmatics around how to introduce mindfulness to this population to actually get them to buy into it so that they can learn from it and gain from it, really. Real quick, I'll just say, the real reason I do this work is because I struggled a lot as a teen. I was in and out of juvenile hall. I was in and out of group homes. Very long story short, I was able to turn my life around, and I was very privileged. I had parents in my household who didn't give up on me. I had mentors and therapists and programs that I stayed in who didn't give up on me. And I was able to turn my life around, go back to school, ended up getting a PhD in clinical psychology, and the rest is history. And kind of where I'm at now is I've been a clinician for about 15 years. And over the past few years, me and my business partner at Family Spring really want to take what we do far and wide. So although I still see clients and I still work with clients, it's a smaller part of my week. A bigger part of my week is spreading what we do through webinars like this, building our clinic so that we can serve as many folks as we can. And that's why I'm here. And I really, really appreciate everyone's attention. And it's an honor to be doing this work. I always say my number one passion is working with youth and young adults. And a very, very close second is talking about working with youth and young adults. So I love to be in these teaching roles and doing these webinars. Okay, here's what we're going to talk about today, folks. Like I said, this is super introductory. We're going to go over assessment. When we're working with youth who are struggling with mental health and substance use disorder issues, we always want to ask the question, how do we know what type of help someone needs? This question doesn't actually get asked accurately enough. So we'll get into that for a little bit. Then we're going to talk about engagement. How do we actually build trust? How do we build the alliance and the relationships, either with the teams we work with, if we're a provider or a therapist like ourselves, or if you're a caregiver or a parent, how do you have this ongoing relationship where you build engagement so that you can kind of get them ready to get into treatment if they need to get into treatment? And then, of course, how we build the actual skill set. The three things you're looking at on your screen right now, this is kind of a watered down version of what real quality evidence-based treatment is supposed to be, right? Like we're supposed to get them an accurate assessment of what's going on in their life so that we can develop a treatment plan so that we can help them to the best of our abilities, right? We want to engage them. If they don't engage in any type of treatment, and if they don't buy into it, the efficacy is going to be a lot less. So the relationship is extremely important. And then, of course, we really want to get them to develop some skill sets so that they can manage their symptoms, so that they can learn how to self-regulate, and so that they can be on the path to healing and self-growth, right? So that's why we're talking about these things today. And again, I'm just going to say it one more time. You'll probably hear me say it a few other times. I'm just going to put the chat down real quick because I get distracted from it. This is a super introductory training. This is a lunchtime, 1 hour long. We'll probably go to about 12:50 my time here on the West Coast, and then we'll have some open Q&A time. If you're here and you're a provider and you're looking and you want to know about continuing education and certificates, you will get an email right after this. We'll talk about how to access that at the end of this training, but you will be emailed right after this. But you got to stay for the whole training to meet CE requirements. I think that's it for now. Real quick facts, quick FAQs. Yes, this will be recorded. You will get access to it later, and you will get access to the slides as well. So we'll talk about that at the end. So let's jump in. Let me just make sure my thing is working here. Here we go. So what you're looking at on your screen right now are statistics that probably don't surprise you. These statistics are often also underreported. So there's probably more than 20 million Americans who struggle with some form of a substance use disorder. It's probably no surprise in this. I mean, it hurts a little bit to say out loud that 1 in 6 youth between the ages of 6 and 17 have some form of a mental health issue. And you see the stats there for young adults as well. And just like the rest of us adults, these folks are also struggling during the pandemic. COVID has increased symptoms in these populations. This will be in the slide deck that you'll have access to, so you don't feel the need to frivolously write this down. But the study that's referencing, I actually have it right here with me now. Basically, they did a systematic analysis of a bunch of different studies over the course of COVID and the pandemic, and they found a number of things that probably won't surprise you, but are still really important. Depression increased in youth, anxiety increased in youth, and substance use increased in youth. That also happened in the general population here in the United States and in the rest of the world as well. But it's also important that this research was done to show us that, yes, what we think is happening is actually happening. COVID has in the pandemic has had a particular strain on young people in their mental health and substance use disorder, just like it has had with us. So that's why we're doing this webinar, right? We're talking about how do we support these young people so that we can get them help to the best of our abilities so that they can be on the path to healing and growth and self-regulation. So let's talk about our first objective, assessment. What is assessment? It's answering that question of what type of help does the young person I'm working with or the young person I live with, what type of help might they need? Remember I said a lot of clinics will do assessments really fast and they'll screen and they'll hop right in to the treatment path. Assessment is actually happening all the way through. If you had, like what we do here at Family Spring is we take a very holistic, person-centered and family-centered approach when we do our work with young people and their families. And so the way we think about it is assessment is always happening. We definitely have an assessment phase, which is at the beginning to collect our data, to really figure out how to answer that question of how do we best help the people that are in front of us. But it's always happening because new bits of information, new data always arises during the course of treatment. I'm just going to share with you a couple of areas. For those of you who are providers on the call today, this may not be news for you, and I'll give you an extra slide with some specific measures that you can think about. But if you're a parent or a caregiver, this could be very eye-opening. It's kind of what we as providers look at to determine the level of need and what we actually need to do in our treatment planning so that we can help your kids, right? So up here, I think you can see my cursor up here. If you can't, forgive me, but I'm circling this top circle that says severity. I'm just going to go over these really quick too. I'm not going to spend too much time. Like I said, this is an introduction, but I want to spend more of the bulk on the time on the action items, which is what do we do to build relationship and get teens to engage and also teach them skills. This is just still a very important aspect of it. So I'm circling the top circle, which is severity. This is oftentimes when folks do screens really quick and they assess really quick, they're just looking at the severity. So in substance use, it'd be like the severity of use. Do they smoke weed every day, 8 times a day, or are they drinking alcohol every other weekend or something like that, right? It's also the duration. How long have they done it? At what point did they start using, et cetera, et cetera. Same thing can be said for other mental health symptoms, right? How bad is the anxiety? How much does it arise every day? The depression, are they experiencing that on a daily basis? Is it every couple of days? Is it every couple of weeks? So oftentimes severity of what the presenting issue is where we start. But these other circles that you see, these other spheres are really important too, because it kind of paints a full picture. And we get this information not just through self-report tests and checklists and things like that. The most important way we get this information is through actually clinically interviewing your kids or the folks that we're working with. We interview them, we interview the parents, the caregivers. Sometimes we even interview teachers as well, because we want to know what type of family discord might be going on, right? Is there substance use? Is there other mental health issues happening, right? Do they have any problems with the law? What's going on with their grades? I get a lot of parents who come into me and they say, you know, I'm not super against smoking weed. I did my thing when I was a kid. If they can just keep their grades at a level that had us at least feeling confident that they could still progress through middle school or progress through high school and get to college, it would be okay. But oftentimes when people start to use drugs or there's other co-occurring mental health issues, grades start to suffer, which is a big thing for teenagers, right? We're looking at their peer group as well. Who are they hanging out with, et cetera, et cetera. And then of course, is there any history of violence as well, which sometimes goes along with the law. We look at both externalizing types of violence, which is getting in fights, et cetera, but also internalizing aspects of violence, self-harm, things like that, which may not necessarily be considered an external area of assessment. By that, I mean things that are somewhat objective that we could see, that we can collect data on. Those, the internalizing factors have to do with the internal areas of assessment. So again, like I said, I was going to go over this very brief, but this is just something we think about. And if you're a provider, you might already know this. It's a good refresher to think about when you meet a client or a patient. It's a good refresher to think about, am I making sure I'm assessing in these different types of areas so that I can get the best picture? And if you're a parent or a caregiver, it's just good to know what the types of things we start to assess, because probably know some of this information. And if you're kind of on the fence about, do I need to get help for my son or daughter or whoever, it can influence you one way or another. Briefly, I just want to go over this briefly. What you're seeing on your screen now is 4 areas of assessment that come from something called the DMQR. This is the drinking, what is it called? I always mess it up. It's the Drinking Motives Questionnaire. I always mess up the acronym, and I'll come back to that slide in a moment. But the Drinking Motives Questionnaire came out in the 90s, and since then there's been a lot of research on it. And since then, there's also been adaptations to look at the motives for not just drinking alcohol, but other substance use as well. So this is a little bit more on the substance use side. But it's really important to not just look externally about what's going on in somebody's life, but also internally as well. Like, what is the purpose of them using alcohol? Is it just recreational, or why are they smoking weed or popping pills or whatever? Is it just recreational? Are they just doing it for fun? That's what the social realm is. It's like, I do it at parties or whatever, right? Or are they doing it because they're trying to get through something? I can't stand, I have to study for this test, so I take a bunch of Adderall, et cetera, to achieve something particularly, right? And then, of course, we all know, well, most of us know, you probably know that for teenagers, the peer group is kind of like the second family. Sometimes it might even feel like the first family to them and to you as a parent, right? In terms of how they engage you or not, right? So are they engaging in that behavior out of social pressure, out of conformity, et cetera, et cetera? And I just want to make sure real quick, I'm just looking. Okay, I want to make sure I don't have any text from my wonderful assistant Fergie, just because I see hands raising. One thing I forgot to say too is, if you have questions that come up, make sure you put those questions in the Q&A at the bottom of the Zoom little bar, and not the chat. It'd be really difficult for us to go all the way through the chat, and I'm not looking at the chat when I present. It'd be really difficult to do that when I'm presenting. So when we get to the Q&A portion, I'll go ahead and I'll check the Q&A, and if there's any questions there, we'll answer them. So where was I? We were talking about conformity and social pressure. That's another thing that we assess, right, internally. And then also coping. Are they using substances because there's something else going on? I've worked with youth who just have general social anxiety. A lot of young people have social anxiety these days, right? And they're just uncomfortable being in certain social situations, so they use drugs for them, particularly recreational social situations, when they go to parties, when they're engaging with their peers, et cetera, et cetera. It could be something like that, or it could be something even more extreme. Like I said, I work in the juvenile hall a lot, and I've worked with youth who've literally disclosed to me that they use marijuana to calm their nervous system down because they have so much trauma from all of the violence that they've experienced, right? And why is it so important to do this level of assessment? It's so important, one, to figure out what else is going on. Recreational substance use does exist. It's not always masking something else, but oftentimes it is. Oftentimes there's an association with it covering up or being used as implemented through the teenager or through the young adult as a way to deal with or cope with something else, like anxiety, trauma, or PTSD, depression, those sorts of things. And when we unearth that material through our assessment phase, and like I said, it's always an ongoing thing, it helps us be able to get to the core, to get to the source of what's going on. If we teach your kids how to manage their substance use cravings and how to communicate with their peers, for example, about, not using or what have you, that can be really powerful. But if we don't get to the source of what's going on, for example, with the kid I was just telling you about, if we don't help them with their trauma and put them on the, not just the path to managing those symptoms, but the path to healing and growth, then there's always going to be something externally that they need to deal with that. So that's why this type of assessment is super important. I'm going to breeze through this slide right here. This is more geared toward the providers. This is in the slide deck, so you will get this. Some basic screening tools, probably the most well-known screening tool for substance use is called the CRAFT, and it's just a basic assessment to give you information on whether or not more assessment or treatment is needed. That's what substance use. The MAISY is more geared toward youth in the system, youth and juvenile justice. It doesn't just screen for substance use, it screens for suicidality, substance use, depression, anxiety, things like that, other mental health issues. And so what a screener is a very brief either interview or very brief self-report questionnaire that oftentimes will let you know as the clinician or the parent that more assessment is needed. And so more assessment is more comprehensive, right? The DMQR, we already talked about that. One of the more famous ones in substance use is the substance abuse subtle screening inventory. The child and adolescent needs and strengths is really good. These last couple don't just do substance use, they do everything, kind of comprehensive mental health. The BASC is a good one. This is a non-exhaustive list. These are just some of the ones that we use at Family Spring. But like I said, what's more important than these assessment tools, than these tests, right? These don't give us the answer to what we need to know. These point us toward the answer. We get most of our information through interviewing the people we work with. That's the clinical interview. The clinical interview is the most important, through interviewing parents, teachers. And like I said, although our assessment phase may be a few sessions in a few weeks, in terms of how we start, it's always happening. If we work with somebody over the course of 8 weeks or 16 weeks or 6 months or 2 years, we're always getting new information that informs us about how to make the best treatment plan and the best treatment path so that we can help the young people we work with and their families to the best of our ability. And it's also really good if you're a parent or a caregiver and your kid has ever been in therapy or any type of treatment. If there's not a clear path, if there's not a clear plan, and you don't know what that is, it can feel sometimes like you're in this abyss of like, when is this supposed to end, or it's just going to be in therapy forever. And when you have a clear plan, of course, the plan can change all the time. But when you have a clear plan where both sides, the identified patient, your kid, you as a caregiver, me as a therapist, where we all know what that is and we all are in alignment about what that is, that helps us work more as a team so that we can meet those goals in a much more skillful way, right? So that's why assessment is super important. It also lets us accurately figure out like what level of need is there. So there's the piece of like the internal of like what we're working on in treatment, which could be trauma in substance use work. It could be depression, anxiety, but it's also what level of care they need. Sometimes they might not need any treatment. Sometimes youth will come in, they recreationally use, they may be struggling with a little bit of depression, which of course is normal during the pandemic. But it may not be that bad, and I'll coach, or one of our clinicians at Family Spring will coach the parents for a session or two, but then we'll make sure they get involved in like the extracurricular activities like sports or other clubs that can help bring their mental well-being up, right? Or they may need what we do here at Family Spring, which is standard outpatient treatment. Standard outpatient treatment is usually weekly therapy or counseling or coaching, and we're a little bit more involved here. We make sure the family's involved. We do more than just that. But the next level of care up will be intensive outpatient, which is what we're launching here at Family Spring. And that's multiple times a week. And that's kind of the last step before or after residential treatment, which is when it gets really tough. If there's caregivers, if there's parents out there who've experienced that before, it can be really, really tough to deal with, to go through, but have all these questions. What type of treatment are they getting? How long are they going to go for? What do we do when we get back, right? IOP, intensive outpatient treatment, can also be used as a step down when somebody gets back from residential treatment. This is why assessment is so important. It helps us figure out what to work on and what level of need is needed for the young people and for the family that we're working with. That leads us to the treatment plan, which is, again, informed by the assessment and helps us come up with the best possible path to helping folks. So that's assessment, folks. I want to move into our second objective, which is talking about engagement through the relationship. Assessment is really important, but equally important to that, and part of how we do our assessment is gauge how well we can build relationships with the young people and with the families we work with. So I want to just let you know briefly as a caveat, I've done trainings that are multi-day events on just building authentic relationships with teens, both from the perspective of providers like a therapist or educator, and from the perspective of parents, right? Like, how do you, because those are two different things. When I'm in my professional role with your teenage son, it's obviously a different dynamic than when I'm building my relationship with my personal son, right? So I'm just going to go over a few tips here for how to do that and talk about them both through the perspective of the provider, but also through the perspective of the parent or the caregiver. And what I really want you to take from this, I'll tell you right now, and I'll tell you at the end of this segment too, what I really want you to take from this is when we build the relationship, the alliance, rapport, etc., when we do that, that builds engagement to us as human beings. So if I'm a provider, it makes the teen more receptive to me. If they were more receptive to me, they're more receptive to what I have to offer, which are the skills we teach, which we'll talk about next. Same thing if you're a caregiver. If you continuously put effort into building a relationship, they'll be more receptive to you as a parent. Doesn't mean they're always going to like you or agree with you, right? Of course, you know that. But when the time comes to talking about getting them into therapy or treatment, which a lot of teens don't want to do, they're going to be a little bit more receptive to you. That's the importance of the relationship. So 2 quick tips for building authentic relationships. Authentic relationship meaning safe relationship, predictable relationship, consistent relationship, appropriately boundaried relationship. It could mean the kind of the buddy, everything feels good. But as you parents and caregivers know, it doesn't necessarily have to mean that, and it doesn't always mean that. And as a matter of fact, if you're a provider and you always have the kind of feel good buddy relationship, which there's nothing wrong with that, the thing you want to look out for is a normal relationship over time, whether it's professional or not professional, has its ups and downs, right? And so if it's always buddy and feel good, you want to be looking in the mirror about what are the things that are getting in the way from taking our relationship to the next level. So who knows who this gentleman is on the screen? You can go ahead if you want to engage. You could put that in the chat. I'll give you just another second. This is a gentleman, a teacher, a master named Thich Nhat Hanh, and I've never met him, but he's informed a lot of my work as a therapist, as a mindfulness practitioner. And one of the things I came across when listening to him was the practice of deep and reflective listening. What you're about to hear is simple, but it can be really profound, and it definitely works in building relationships with teens. What's deep listening? Deep listening is the type of listening that can help you relieve the suffering of another person. This is a quote from Thich Nhat Hanh. You can also call it compassionate listening. You listen with one person with one purpose to help them empty their heart. So it's not, and this can sometimes be hard for therapists. Therapists can go into solution focus mode. They're listening to a problem. And they start to think about how to fix it, right? Or what to do, right? It's not doing that. Or if you're a parent or caregiver, it's very easy when you're listening, particularly to a problem, particularly if your young person is in trouble, it's very easy to get ahead and start to get frustrated, get anger, start to figure out what you're going to do to punish them, et cetera, et cetera. This is not that. Deep listening is literally listening to somebody with your full presence. It's keeping your mind here and now, maybe a little bit on your body to anchor yourself in the present moment, possibly your breathing, and giving your full attention to the person that's talking, to the young person, right? To what their experience is. Just going to do another quick check real quick. I want to take another one. I'm seeing a lot of hands being raised. Again, if you can't hear or see me, that's probably something on your side. think about your internet connection, stuff like that. And if you have a question, make sure to put that in the Q&A, not in the chat. Okay, so deep listening, here's a little conceptual map of how listening leads to connection. It doesn't always happen this way, but oftentimes it happens this way, right? If you listen to somebody, this is just in general, if you listen to somebody, you're much more likely to understand them cognitively, right? If you don't listen to them, if you don't give them the time of day, it's going to be difficult to understand their position. But if you actually listen to them, you have much more of a chance to understand them cognitively. If you understand them cognitively, you might have more of a chance to understand them emotionally. Understanding somebody from an emotional perspective is where empathy can arise, trying to put yourself in their shoes, trying to really understand the emotion of what they're experiencing. And if they're going through a rough time, for example, if they're dealing with anxiety, et cetera, issues with their friends, and you're actually open and you're present and empathy arises, that's the doorstep for compassion to arise. And when compassion arises, that's when you feel like you're present to the suffering of the person you're listening to. But you also have this wish to relieve it, right? That's why deep listening is so important, and not letting yourself get triggered if you're a caregiver or a parent, because you don't want to sidestep the compassion and go straight to the anger or straight to the frustration. If you sit with the compassion, then you can really start to fully understand the position that they're in. And when that happens, more connection happens. Research shows that young people that we work with, if they view us as caring, empathetic, and compassionate, efficacy goes up no matter what you're doing, whether it's education, mental health, substance use treatment, et cetera, right? And sometimes for parents, it can be really, in caregivers, it can be hard because you can get on automatic pilot, and you're so used to telling your kids what to do or responding to some trouble that they got into, for example. It's so important to make time to just be with them, to talk with them, to hear them out, to give them that time of day. When we do that, we give them a socio-culturally corrective experience, because they don't get that from any other adult. And sometimes they don't even get that at home. So when that happens, they know that we're giving them the time of day. I'll tell you a very quick story. One time I was referred a gentleman who, this was an adult, but I've had this experience with youth a lot as well. And, this what's coming to mind. I was referred this gentleman who, his son, who was in 5th grade, their mom had walked out when he was 1 year old. Fast forward 10 years later, the mom comes back into their life, and it's causing a lot of anxiety in this family. Got to go to court, all of this, right? So the son gets referred to a colleague of mine for therapy and counseling to determine if he's okay to see his mom. And the father gets referred to me, and they say, you just got to go to therapy for at least one time and just make sure you're okay, because it's a really stressful situation. So he calls me up and he says, Sam, I don't really believe in this therapy BS. I'm just here for the court, right? And I say, that's totally okay. Come in. I'm not going to judge you. I'm not going to tell you what to do. I'm not going to overanalyze you. Let's see what's going on and see if I can help. He comes into the first session, and of course, he's never fully told the whole story like this before in a confidential setting. And when he starts to talk about what's going on and the weight on his shoulders, the anxiety, all that stuff, et cetera, he starts to cry. And when that happens, what am I doing? I'm just practicing deep listening. I'm being present. I'm throwing some reflections of what I'm hearing. But for the most part, I'm being present and I'm listening to him. And at the end of the 45-minute or so session, he looks at me and he says, Sam, and some of you may have heard this before too in your practice if you're a provider. He said, Sam, I like your vibes. I like your vibrations, basically. What does that mean? I like your vibes. What does that mean? It means I feel safe with you. I'm not feeling judged. I'm not feeling overanalyzed. This was a guy who was only required to come once. Because of that rapport building at the beginning, he came into therapy for months on end. That's how powerful deep listening can be. It's very simple, but it can be very, very powerful. If you're a provider, do this with your clients and tell the caregivers about this, and really encourage them to practice this. And if you're on this call and you're a caregiver or you're a parent, really think about how you can implement this in your life. And one quick tip I want to give you for the parents and the caregivers, but really this is for everyone, is there is a chemical in our brain called adenosine. and it's involved in sleep and our circadian rhythms. And you probably know, for those of you who have teenagers, not this isn't an absolute statement for everyone, right? But it happens, right? A lot of teenagers like to stay up late because their circadian rhythm clock is a little bit adjusted. So when you're ready to fall asleep, it's 10:30 or 11 o'clock, and you're like nodding off, basically, they're coming into the kitchen for that close to midnight snack. And you might notice that for a lot of them, they could be a little bit chatty during those times. That is an excellent time to just be ready to have a conversation, not grill them, just get to know them as a human being, practice some deep listening here and there. They will completely, trust me, they will remember that if you're able to do that, right? You want to have time, especially if you're dealing with a lot of conflict at home, you want to have times where you're conversating with them, talking about life, whatever, without conflict, right? The conflict is going to come up. You're going to be able to get your point across and set that boundary. And that argument will probably happen if it's happened throughout the day. Make sure there's some time where that doesn't happen, right? That's how, one of the ways I coach parents. So that's deep listening. The other quick tip, and I'm going to go over this super fast because of time. I really want to get to the last skill. Deep listening is an offering practice, or excuse me, it's a receptive practice, right? It's information and energy is coming towards us and we're observing it. Self-disclosure and skillful self-disclosure is an offering practice. It's kind of the other side of the coin, where sometimes teens want to know who you are as a provider. Sometimes they want to know who you are as a parent or a caregiver. And it's really important to be able to self-disclose at times, appropriate, of course, appropriate and skillful information. All skillful means in this situation, skillful self-disclosure is another way to say healthy or appropriate self-disclosure, which is what I'm about to say, if you're a therapist or a provider, is what I'm about to say about myself in the best interest of the young person I'm working with. Or if you're a caregiver, is what I'm about to, or a parent, is what I'm about to say about myself, is that going to add value to our relationship, right? So it's not just about you, it's about the relationship as well. And for therapists, we know sometimes we get asked questions like, do you smoke weed, or have you done drugs, or what have you been through, et cetera, et cetera. And it is really important that we want to humanize ourselves, but we want to have boundaries as well. And if you're a parent, the best way that I've coached parents to use skillful self-disclosure to build the relationship, this is not the only way, I want to put this caveat out, but the best way is, particularly when conflict comes up, if you are struggling and you're angry about something, let's say your kid snuck out or something like that, and you caught them smoking weed, they snuck out of the house. Oftentimes when I really sit down with parents and say, okay, you're really angry about this. If my kid did that, I'd be super angry too. That makes a lot of sense to me. But what's under the anger? If you go a layer deeper, oftentimes what's under the anger is fear or concern. I don't want my kid to get arrested. I don't want them to get hurt, et cetera, right? So one way parents can use self-disclosure, like I said, this is very brief, this is very introductory, right? So just think about this as a seed to be planted. You don't need to actually do anything right now. But one thing you could do is start to learn how to express yourself authentically and say, when you snuck out the other night, it scared the living hell out of me. And I know I reacted with anger, and I know I yelled, but what was really going on is I was really angry. I was really scared. I was really concerned about your safety. Sometimes when you show a little of that emotion to them, it humanizes you as a parent or a caregiver. It can be really, really powerful. So skillful self-disclosure, I'm going to leave it there for now, just because I'm looking at the time. I said I do the relationship sometimes in a whole day or a multi-day event. I've done a whole day long on just skillful self-disclosure. So what I just shared right there is very, very much the Cliff Notes. I want to go to our third objective, which is talking about skill development. At Family Spring, one of the things that we emphasize and we will emphasize is the development of mindfulness and mindful self-awareness. And whenever I start a group, or whenever we work in one-on-one therapy and coaching, we define mindfulness using a metaphor called the lion mind versus the dog mind metaphor. So I figured what I do for these last 10 minutes is I just give you an actual snippet of how we work with the young people. And we'll contextualize that a little bit, and we'll practice a brief mindfulness meditation, and then we'll get into Q&A. So the lion mind versus dog mind metaphor, I first came across this when I was working for a program called the Mind Body Awareness Project. It actually comes from a book called Breath by Breath, written by Larry Rosenberg. And we took that when we were working at MBA and we made it our own. I've probably shared this metaphor thousands of times with youth over the past 12, 15 years. It goes a little something like this. So let's say that this being this is a meditation bell that I'm holding in my hand. If you can see me in the corner, let's say that this is a bone and I'm standing in front of a dog, right? And I wave the bone in front of this dog's face. And then I throw the bone 5 yards to the right. What do you think the dog would do in that situation? If you feel like engaging, you can put that in the chat. What do you think the dog would do when I throw the bone 5 yards to the right? Well, most of the time, the dog will probably chase the bone, right? Unless it's one of those really smart dogs that don't do stuff unless you command it to, right? But for the most part, the dog would go and chase the bone. Now, let's say, and I don't know why I would ever be in this situation. Now, let's say that I am standing in front of this lion, this majestic looking lion. Why would I be standing in front of a lion? I have no idea. It seems like it could be really dangerous. Let's say I wave the bone in the lion's face and then I throw the bone 10 yards to the right. What do you think the lion would do in that situation? And you can put in the chat if you'd like to engage. I don't actually know what the lion would do because I've never been in that situation, but this is a metaphor. And if you're anything like a lot of the youth I work with or have worked with, they say the lion will eat you, right? And I always say the lion could eat me. The lion could come after me, but there's a fundamental difference between the mind of the lion and the mind of the dog. With the dog, when I'm waving the bone in the dog's face, I love dogs, by the way, but when I'm waving the bone in the dog's face, what are the eyes of the dog doing? They're clocked on the bone. I wave the bone over here, over there. The eyes follow the bone. I throw the bone. The dog goes and gets the bone. The dog has tunnel vision to the bone. So at least for those moments, the bone represents the whole of the dog's reality. If I control the bone, I control the dog's reality, at least for those moments. But what are the eyes of the lion doing? When I'm waving the bone in the lion's face, the eyes oftentimes are looking through the bone, looking right at me, right? Can the lion see the bone? Yes, the lion can see the bone, but the lion also sees the larger reality. It sees the person waving the bone. It sees the person throwing the bone. And that gives the lion more choicefulness because the lion has a different perspective than the dog. The lion can go get the bone. The lion could come and eat me because there's more bones in my body than there is in my hand. Or the lion could just stare at me for, being a dummy for being in that situation, right? It gives the lion more choicefulness in how the lion wants to respond. If we take the analogy one step further, think of the bone as anger or depression or anxiety or a craving to use drugs or trauma. When anger arises inside of me, if I react with the mind of the dog, I do whatever it is I do when I get angry. My fists clench, I curse, I yell, I fight, whatever it is, right? It's tunnel vision. But if I respond when anger arises inside of me with the mind of the lion, it's different. I might have the thought, I'm angry right now, which is a little bit different than the dog, right? There's a little bit of awareness of what's happening with me. Or I may have the insight, I've been angry before, I'll be angry again. This isn't going to last forever. What that does is it disidentifies me from the experience of anger. I'm not the anger, it's just an experience that's coming up inside of me. And that helps me respond a little bit more and have more autonomy and choicefulness. That's what mindfulness is. Mindfulness is paying attention in this moment, being present moment oriented, and having an attitude of equanimity, which basically means non-reactive, balanced mind. Doesn't mean there's going to be no bones, right? Doesn't mean I'm always going to be calm and serene. It means when the bones of anger or depression or anxiety or irritation, when they arise, I'm changing the attitude to which I'm approaching and being present to those bones. I'm being responsive rather than reactive. That's what mindfulness is. And so I teach this metaphor with the youth that I work with. We teach this in our programs at Family Spring. We'll be teaching this in our upcoming program at Family Spring as well. And And then I also teach actual mindful breathing and other types of mindfulness as well. We don't have time today to go over all the different ways we teach mindfulness, but I did want to give you just a kind of a snippet, maybe a 90-second snippet of one way we can teach mindfulness. So I'm going to do that through mindful breathing. So if you're willing and able, go ahead and get a comfortable position. We're just going to do this, like I said, for about 90 seconds. If you're willing and able, get in a comfortable position. If you'd like to close your eyes, you can, but you absolutely do not have to close your eyes in order to do this practice. When you hear the sound of the bell, just start by bringing your awareness to your breathing and then wait for further instructions. Again, this is just going to be about 90 seconds. Breathing in and breathing out. Just take a few moments to notice where it's easiest to sense your breath. Maybe that's the nostrils. Maybe that's the belly or the chest. Wherever it's easiest, just let your awareness rest right there. Breathing in and breathing out. You might notice after a few breaths in and a few breaths out that the mind begins to wander. You start to think about things other than the breath. Whenever that happens, just gently bring your awareness back to your breathing, wherever it's easiest to sense your breath. Breathing in and breathing out. Your mind may be calm and serene right now, or it may be active or overwhelmed. Whatever it is, that's okay. The goal is simply to use the breath to draw your awareness into this present moment. Breathing in and breathing out. And then in a few moments, I'll ring the bell. And when I do, I just want to invite you to try and listen to the sound of the bell until you can't hear it any longer or until it's no longer there. And then when you feel comfortable, when your eyes are closed, you can slowly open them, expanding your awareness to the rest of the room, coming out of the formal exercise, doing what you need to do. If you need to stretch, just drink some water, coffee, or tea. Just getting into the home stretch of the presentation here, folks. There are a lot. If you'd like to put in the chat how that made you feel, that's great. And thanks to some of you, I'm noticing some good resources in there. Go ahead and put in the chat how that made you feel, whether you feel calm and rested, or if you still feel overwhelmed, jumbled, if you're not feeling calm and rested, if your mind wandered, like some people said, that's totally okay. This practice is designed to come back to over and over again. And when we're focusing on a breath, for example, and the mind wanders away, we train ourselves to become aware of that and bring our mind back to our breath. That's how we're developing the skill of self-regulation. So a couple of quick notes. There's many types of mindfulness. We just completely scratched the surface here, barely scratched the surface, I should say, right? And there's many types of skills and types of self-regulations even beyond mindfulness, right? We didn't have time to go into that today as well. But some of you may be asking, how, before we get into the formal Q&A, a lot of people sometimes ask, well, how do you get somebody to meditate? Wouldn't it just be great if you could walk in and say, yeah, we should practice mindfulness and meditation. And if you practice this, it's like any other skill, you get better at it, you'll get proficient in it, and you'll get better at self-regulation and develop insight, et cetera, right? So a lot of times people will ask, well, how do you get folks to do it? Well, the answer to that is in the second objective that we had today. If we want folks to feel comfortable enough, or at least be able to be willing to take the courage to push the boundary and do something they wouldn't normally do with a therapist or even with a parent or something like that, we have to focus on the relationship objective too, right? And what we do in the relationship and how we build that relationship is somewhat informed by objective one, which is making sure our assessment is really, really accurate, right? So like I said, I'll say this probably multiple times, right? The more we focus on alliance and rapport and relationship building, the more engaged they'll be with us as human beings. They'll be more receptive to what we have to offer, so that when we get to the point in the treatment or in your relationship with them, even if you're not a clinician, when you get to that point of saying, hey, have you ever tried mindfulness, or have you ever tried, and then you insert some other type of self-regulation technique or skill that could be helpful to them, they're just going to be much more likely to be receptive and give it a shot. We don't need them to be super gung-ho about it. We just want them, even if they're ambivalent, it's okay. We just want them to be able to try it, right? Because then when we try it over time, we can then help them gain proficiency and really bear the fruit of the practice. So just a quick review before we hop in the Q&A. What did we do today? We talked about the importance and the reason and the purpose for why we're here today, with everything that's going on with COVID, with the mental health in the SUD epidemic that people are really dealing with already on top of that, right? And then we talked about three very brief objectives, right? We talked about assessment. How do we know what type of help we need, which is really important. We talked about engagement and how we build trust in relationship to get youth receptive, so that we can then get to the third objective, which was the skill piece. How do we build skills in young people so that they can manage themselves, practice self-regulation, impulse control, build authentic relationships in their life, know where their boundaries are with the people are with their friends and things like that, so they can deal with peer pressure and conformity and things like that, so that they could be on the path to healing and growth. And that's what we're all about here at Family Spring. This is what I'm super passionate about, and I really, really, really appreciate your attention. So we have about 9 minutes left, folks, and I'm going to go to the Q&A and see if we have any questions here. Here we go. Okay, let me just scan all of these real quick. A lot of these are logistical questions. Yes, of course, we're going to have a replay. It's going to go out, and then we have a couple of clinical stuff here. So we'll go, probably just have time for one or two of these. Let's see. Okay, yes, this will be available for view. Here's a good question. How do you pick back up with a teen who's relapsed and OD'd 1 week after 3 months out of detox, wants to stop but doesn't? Second session came back, he was high. Do you just pick back up the same place? This is an excellent question. Thank you, Denise, for asking this question. Essentially, sometimes people are going to relapse, right? And which means they may have been sober for a while, and then a mistake happens. This is a really good learning point for both sides, both the client and the therapist. It's really what my philosophy is, and like I said, I'm person-centered, right? And my outlook on substance use disorder is also person-centered, meaning I don't subscribe to either the abstinence-based model or the harm reduction model, right? With teens, harm reduction works a little bit more, but the reason I don't subscribe to either of those absolutely is because for some teens, abstinence is going to work better, at least in their mindset. And for other teens, harm reduction is going to work better. But the person-centeredness of it is, if they relapse, what I do is really important. If I kind of point the metaphorical finger at them, that would probably be counterproductive, and they probably would not feel safe with me, right? If I approach them with compassion and with a genuine interest of understanding what happened, and why it happened and the purpose of what happened, what led up to event, kind of do like a chain analysis, which is sometimes done in DBT, or a functional analysis, which is where it originally came from a place of compassion and from a place of keeping the relationship centered. It's like, hey, you made a mistake, and you're a human being, you'll make mistakes, especially in the way the question was worded. The person wants to stop, so I want to support that, right? So that's how I would approach it. The short answer is yes, I would pick back up, but I would use those sessions as a way to really gather data and to kind of be side by side and aligned and build that alliance with the client around what happened. What was the things that triggered you? What were the things that, what is the thing that gets in the way of this goal that you say you have of being sober, right? That's how I'd approach a situation like that. And if you're a parent, that might be hard to hear sometimes, because sometimes parents want us as therapists or treatment providers to kind of like put the hammer down on them. But really, especially when a kid wants to stop or is willing or ambivalent even, what's more important is that we as providers and parents and caregivers align together about how we're going to approach it. It's okay for you as a caregiver, for example, to put the hammer down a little bit and be like, okay, this happened. So what we agreed to was these privileges are being lost, or these consequences are going to be in place, right? The key is that you talk with the provider and that you have open lines of communication so that everybody's aware of the plan to approach that young person in a situation like that. So great question. What I'll do also is I'll have my assistant Fergie download these questions as well, because we won't be able to get to all of them. If there's some other clinical ones, we won't be able to send that out in the email today because I won't have it done, but maybe in a follow-up email in a few days, I can kind of bullet point some of these questions because a lot of them are frequently asked questions. And so the last thing I want to do with you before we tell you how you get your certificate is just tell you about our program here at Family Spring. Like I said, this, maybe I forgot to say it, but this webinar is being sponsored by Family Spring. It is obviously, we're not your therapist just because you're coming to this webinar. We're just doing educational kind of ideas to support the public in general. But we do have an actual clinic here in California. And our mission really is to reinvent substance use disorder and mental health treatment for teens, young adults, and their families. That's what we're about. We have a lot of great clinicians like myself who are passionate, who have their life experience. And what we do here is we're actually just about to launch a wait list for an intensive outpatient program specializing in substance use disorder. That's going to be both online and in person. We have our outpatient clinic that is already up and running. We work with kids who are dealing with substance use disorder, but also depression, anxiety. They don't have to be dealing with substance use disorder. And as a matter of fact, we have some really amazing rock star clinicians with some openings. So if you're here in California, we'll give you the information about how to refer to us here in a minute. And in all of our services that we have here too, we do aftercare follow-up. We really get involved. We also just do non-clinical support. Sometimes that can be caregiver or family coaching, right? And sometimes that's the entry point to get, for example, a resistant teen into treatment. Everything we do is trauma informed. It's culturally humble. There's a big evidence on mindfulness. There's a big emphasis, on evidence-based treatment, things that actually work. And we're also very tech accessible as well. What we're just about to launch just in a few months here is our home-based app. And this essentially helps teens and families and our treatment providers stay on track with what you're doing. So you always, as a parent, for example, know what we're working on, and you get little homework assignments too, so that this can be a really holistic family-based approach, because that's what leads to the best efficacy, right? So that's a little bit about us here at Family Spring. If you're in California, I know there's folks here that are not in California right now. Our operations are just in California. We have a physical office here in the Bay Area, and we can see people virtually, of course, across the state of California. Fergie is going to put the link in. It's just myfamilyspring.com/get help now. Please, if you're a parent or caregiver and you think you need help for your particular situation at home, please go ahead and fill out the inquiry form on that website. If you're a provider, you can send this link to parents, or you can refer directly to us. And like I said, we are starting our wait list for our intensive outpatient program here in California that's SUD focused, substance use disorder focused. So, folks, that is pretty much it for today. If you need CE or your certificate of completion, be on the lookout for an email in just about an hour. The email is going to come out. It's going to say how to get your certificate from today's training. There's going to be a link. That link is going to take you to an evaluation. You know, for CE, we have to do an evaluation. Once you fill that out, it'll take no more than 5 minutes. You'll click submit, and that will redirect you to a place where you're going to then download your certificate. The certificate has all the information from today's training except for your name. You can either add your name and save it as a PDF or print it out and write your name in. Folks, it has been an honor. Let's see here. Yes, I'm unsharing. Good. It has been great. This has been a great lunchtime hour with you. Stay on the email list because we'll be announcing very soon the next one of these webinars. We're going to be doing this approximately monthly, and we're going to have CE and certificates set up. And it'll probably have a very similar theme in the sense that, or at least in the sense that it will meet the minimum threshold for continuing education for providers, but we'll also kind of gear it towards caregivers and parents as well. So I hope you all have a wonderful rest of your Thursday. Please send us those referrals if you know somebody who is in need of help. We are passionate and we are ready to serve. Thank you so much, folks, and we will see you at the next one, hopefully. Bye-bye.